All right, so we're going to talk about nursing diagnosis now, and I want you to stop panicking and breathe first, right? Because you've probably heard all kinds of things about nursing diagnosis, or you've seen long, complicated words or ways of saying things. And this is the part of care planning that tends to be the most challenging. So here's the thing. You already know how to identify a problem. Most of you are able to identify if the problem is a nursing problem or a doctor problem, right? Is this a nursing problem or is this a provider problem? If your background is not in nursing, you might need to figure out the difference between those things, okay? But you can do that. The nursing diagnosis is just a way of stating that. We use NANDA in this program because most facilities that still use nursing diagnoses use NANDA. So when you're doing NANDA diagnosis, there's a formal way to write the diagnosis. I don't want you to get stressed out about it because a lot of times students are like, oh my gosh, I don't know what to put. I want you to start with thinking about what's going on with that patient and put it in plain language first, and then go back and figure out how to use the fancy words. Right? Okay, so first of all, what isn't a nursing diagnosis? Nursing diagnosis is different from medical diagnosis. Medicine diagnoses illness or injury. Nursing diagnosis responses to an event or to a life process. Okay, so think about human responses. Nursing is about humans. We're not about the illness. We're not about the surgery. We're not about the diagnosis, the medical diagnosis. We're about humans, that human. How is that human responding to what's going on with them? Collaborative problems are not nursing diagnoses. They're listed sometimes along with them, but collaborative problems really need to manage by more than one discipline. And most of the interventions require a provider order. So if most of the things you want to do for your patient require an order, that's a hint that maybe it's a provider problem and not a nursing problem. It's also not just paperwork that you've got to do to get through school. When you go into nursing practice, I want you to be able to think through. I want the nursing process to be second nature. I want that to be how you address your patients. And you might need to actually document a care plan somewhere. Frequently, the way care plans are documented in EHR doesn't have a lot to do with what's going on with the patient. I would like to fix that. I don't have the power currently to fix that, but you may be in the place at some point of actually documenting formally the plan of care for the patient. So I want you to have the ability, even though you may not use such a formal way of care planning as a working nurse. You're still, as a nurse, you're still using the nursing process. You're still addressing your patient in that way. Okay, so what is a nursing diagnosis? It's a statement that describes a human response to an event or a life process. Okay, so think about human responses. Nursing diagnoses can refer to individuals, families, or communities, and they should form the basis for our nursing interventions. So when you go to work as a nurse, you don't just follow the orders. You don't just check the boxes. You're deciding, you're using your nursing judgment to determine what care that patient needs and make sure that it happens. So there are different types of nursing diagnoses. An actual is the most common. This is a problem that is present at the time of the assessment. So if my patient is not oxygenating well, then his problem is an actual problem. He is not exchanging gases well, right? If an at-risk means in the nurse's professional clinical judgment, the client has risk factors for a problem that has not yet occurred. One of the big mistakes I see is that nursing students will say risk when the patient already has that problem, okay? It's not risk for ineffective gas exchange if their SATs are 85%. They have ineffective gas exchange or impaired gas exchange, I think is the way it's stated. Does that make sense? So differentiate actual and risk, okay? There also are wellness diagnoses that describe a human response to a state of wellness. And that may be those may begin with readiness for enhanced. And a common example of that is if someone is all caught up on their vaccines, their readiness for enhanced immunization status. Okay. Don't use readiness for enhanced to indicate that someone has a problem. If someone is not getting enough nutrients, they do not have readiness for enhanced nutrition. They have a nutrient deficiency, which I think it is inadequate nutrition, less than body requirements. Okay. I think that's the fancy words. So you need to know what the definition of these types of diagnoses are so you can choose the right type. Actual, they have the problem. At risk, they have factors that put them at risk for that problem. Wellness means that they are in a state of wellness, and that's their response. So what does a nursing diagnosis look like when we make it formal? We choose a diagnostic statement or a NANDA label that describes the problem. So the first part of a nursing diagnosis is what nursing sensitive problem do they have? Okay. The second piece is the etiology, and this is why they have that problem. This is contributing factors or causes. And then the last part is how do we know? Okay. So we're going to run through this with our pneumonia patient who is coughing and congested and not bringing things up and is slumped down in the bed, and his SATs are 89 and his oxygen's hanging on the IV pole. Okay. So we're going to think this guy has really two different problems. Now, the doctor is treating the pneumonia, but as a nurse, we identify that he's having problems with gas exchange. Okay, so one of his problems is hypoxia. One of his problems is that he has a lot of gunk in his airways. He's having problems with airway. Okay, how do we decide which one of those is the highest priority? Those are actually pretty close, and for those two, I would decide based on which is the most severe. So let's choose one of them because he already is hypoxic right now. How can we get more air, get more oxygen into his bloodstream? So that's our problem, is he's hypoxic. Why is he hypoxic? Well, he's hypoxic because he's not getting good lung expansion because he's all slumped down in the bed, because his airways are tight, and so he's airway constriction, and because he has excessive mucus in his airways. Okay. So that's the why. Now, how do we know that he's not getting enough oxygen? His O2 sats are low. He seems short of breath. He has retractions. He's blue around his mouth, right? Don't mix up the why with the how you know. That's where understanding, that's where clinical judgment comes in. Okay. So how do we turn that into NANDA language? This guy is all slumped and wadded up in the bed, and his lungs are congested and they're constricted. So how do we turn that into a fancy name nursing diagnosis? The first part, because we use NANDA, the first part should always come directly from the NANDA list. And if you have your nursing diagnosis handbook, okay, the NANDA list is in the covers, okay, front and back covers. That's a complete list. Is it front and back this time? One edition had front and back, and one edition had all. No, it's just the front 2 pages, okay? Here's your list. So there's 2 pages, back and front of a page, your nursing diagnosis book. Okay, so you have that book and you go through that list and you're like, okay, this one sounds like it might fit impaired gas exchange. And so you go to impaired gas exchange, which is, let me see. These are in alphabetical order, but they have, they're in alphabetical order by the main problem. And so defining words are not, or modifying words are not included. So impaired gas exchange is in the G's because it's a gas exchange problem. So if you have a hard time finding them, look in the index and it'll tell you what page to go to. All right, so impaired gas exchange, I'm going to look at this. It's on page 420 if you have the 12th edition. If not, if you don't have the 12th edition, you're going to have to figure out what page it's on. So first is the definition of impaired gas exchange and then defining characteristics. If you think this is your nursing diagnosis, read the defining characteristics and it's going to tell you what you're going to see on assessment. Okay, so let's read them. Abnormal ABGs. Well, we don't have ABGs. Abnormal arterial pH. Don't have that either. Abnormal breathing pattern. We've got that. Does this patient have an abnormal breathing pattern? Well, one of the things I would have wanted to assess is his respiratory rate, and let's just say it was 32. Okay. And he's working to breathe. Abnormal skin color. We've got that. He's blue around his mouth. Confusion. He's a little confused because he's worried about his bowels instead of his breathing. Decrease in carbon dioxide level. Don't have that. Diaphoresis, dyspnea, headache on awakening, hypercapnia, hypoxia. We've got that. So we don't have every characteristic, but we've got enough of the characteristics on this list to say this guy is not exchanging gas as well. So impaired gas exchange, and that part has to be the fancy NANDA label. Now in this book, you're going to see related factors, you're going to see associated conditions, you're going to see NOC outcomes and NIC, and you're going to see suggested outcomes and suggested interventions. Those can be helpful, but they are not your care plan. Your care plan is the patient in the bed. So if you are stuck for interventions or goals, you can look at those, but you're still going to have to relate them to your patient. You can't just copy the goal out of this book onto your care plan because it's not going to match your patient. You've got to put it in your own words. The same thing for the reasons. Okay. So I'm going to say this patient has impaired gas exchange because that is the NANDA label. Related to, you use the words related to. Got impaired gas exchange. Why does this patient have impaired gas exchange? Well, because of inadequate thoracic expansion and bronchoconstriction and excessive mucus. Okay. Those are the why, and those are the things I can try to fix to improve his O2 sats. So impaired gas exchange related to bronchoconstriction, excessive mucus, inadequate thoracic expansion. Now, how do I know that this guy has impaired gas exchange? I'm going to say as evidenced by, okay, as evidenced by, his O2 sat is 80, was it 89? 89%. He is, appears to be short of breath, and he has circumoral cyanosis. Okay. Students frequently mix up the why and the how we know. So know the difference between those. In the pattern, it is the problem related to why as evidenced by how we know. Okay. Problem related to etiology as evidenced by evidence. And what you put in that as evidenced by needs to be stuff from your patient assessment that matches the defining characteristics of that diagnosis. All right. So my final 3-part nursing diagnosis for this patient is going to be impaired gas exchange related to excessive mucus, bronchoconstriction, and inadequate thoracic expansion as evidenced by O2 sat 98%, patient visibly dyspneic or short of breath, circumoral cyanosis. Okay, that's what you're going to put down. So the process of writing a nursing diagnosis. Now we're going to go to a case study to do this. Okay. We've talked about it. Now I'm going to pull up a case study and we're going to go through that process of writing a nursing diagnosis for this patient. Okay. If you remember Mrs. T from our case study day, we're going to go back and see Mrs. T again. And we took some steps toward this care plan. So now we're going to walk through and figure out how to make this more formal. All right. So the first thing we do is what do we notice in the assessment? She has a large sacral decubitus. It's suspected to have MRSA. She has a frail appearance. She's breathless while transferring. She's on oxygen. She takes the bus, but she gets exhausted trying to get groceries. Her daughter brings groceries once a week. She doesn't eat a lot, too much effort, not very hungry. So she eats about once a day. And what she eats is crackers and cheese, applesauce, or yogurt, lots of chocolate candy and coffee. She's a smoker. She has COPD, but doesn't know what it means. She takes a lot of meds, but doesn't have her med list with her. Okay. So I want you to look for patterns, and we see several patterns. She's got a wound and she has a lot of things that are going to impair healing for that wound, right? She has this wound probably because she is too weak and breathless to get up and move around much. Okay, so that's what got her into this position, but also her nutrition is not very good. She's very frail. She has COPD, so her oxygenation is not good. So think about the things that contributed to that wound. And she doesn't manage her COPD because she doesn't even know what it means. So think about what you want to do for your client. Well, I want to help this client manage her COPD better. And I want her to help her take care of her wound. And I want to help improve her nutrition. Okay. We could choose any one of these things to make a nursing diagnosis. Any one of them. We want to look at what the highest priorities are. Right now, the highest priority is probably the wound, but we're not going to improve the wound without helping her nutrition. I want to look at her nutrition. Okay, so let's pick nutrition. We could probably list some other potential problems that we want to fix for her, right? What do we want to make better? Okay, why do I want to make that better? So we look at these problems. What's a nursing problem to fix? Now, management of her COPD is probably collaborative. If she's got the right prescriptions, she's got the right testing and things like that, and she just doesn't know how to use it, that's a nursing issue, but she may actually need more medical follow-up for that. This wound is infected. We can do wound care, that's nursing, but also that infection needs to be treated by the provider. Nutrition is a nursing problem that we can fix. So these can be nursing, but they may be collaborative. This is a nursing problem. So we think she's not getting enough nutrition. So I'm going to look in my NANDA book, my Ackley Nursing Diagnosis Handbook, and I'm going to look at nutrition related. Now, what if I don't know what words to look for? In this book, if you look at the spine, let me unshare for a second. If you look at the spine, these purple tabs are specific diagnoses. The green is a section that you can go and look something up and get a list of possible diagnoses to look at. So let's go look at nutrition. Is nutrition in here? It is. There is nutrition, and it says readiness for enhanced nutrition, and then there's nutrition imbalanced, and it's got a list. So do any of those make us think maybe she might have this problem? I like imbalanced nutrition less than body requirements. So we're going to go over to, in the purple section, oh, that opened to that by accident. Page 651, we're going to see imbalanced nutrition less than body requirements. So take a minute and open your book to that page. Okay. Open your diagnosis book to that page. and we look up that diagnosis. Look at the defining characteristics. In those defining characteristics, is there anything in Mrs. T's assessment that matches those defining characteristics? Okay. She is very frail. She has a wound. She eats once a day. She only gets groceries once a week. She's too tired to go to the grocery store. She's too tired to fix something to eat. She eats crackers and cheese, applesauce, yogurt, chocolate candy, and coffee. Okay. All of those are things that if you look at the defining characteristics in that book, you're going to say, oh yeah, that's there. So this is a good diagnosis for her. Okay. So we're going to keep our diagnosis: imbalanced nutrition, less than body requirements. Now, why does she not get enough food? She is not eating enough. Why is she not eating enough? Okay. If your diagnosis is a risk, at this point, you're looking at things that put them at risk. So if it's fall risk, why is that particular patient at risk for falls? Okay. But this is an actual one. She actually is not getting enough food in, nutrients or calories. It's possible to get enough calories or even too many and still not get enough nutrients. But in this case, she doesn't get enough of either. So it's because she doesn't have the energy to cook or shop. She doesn't have a lot of appetite. Okay, so inadequate energy for meal preparation, decreased appetite. That's our etiology. So imbalanced nutrition, less than body requirements, related to inadequate energy for meal preparation and decreased appetite, as evidenced by, here is how do we know? How do we know she's not getting enough to eat? She appears thin and frail. She reports eating one small meal daily, reports lack of appetite and lack of energy. This is your 3-part nursing diagnosis. Remember that the etiology related to is why the patient has the problem. This is how we know. Don't mix those up. I see a lot of students mixing those up. Okay, there are some variations. This is a 3-part diagnosis. A 2-part diagnostic statement has the diagnosis and etiology only. Wellness diagnoses and syndromes have only the NANDA statement. There's no etiology. Risk diagnoses are going to have risk factors, and that's going to be listed as the related to. They don't need evidence because the evidence is the existence of the risk factor. You would just be repeating yourself. We can say unknown etiology or complex factors, but then we've got to be either working on all those complex factors, or we've got to be figuring out what the etiology is. I don't know why this patient has fever. So what am I figuring out? Okay. We can have a possible diagnosis that we're considering. If you have a patient and the etiology does not adequately explain what's happened, I'm going to give an example. Your patient has a nursing diagnosis of acute pain related to inflammation. That may not give you enough to go on. That may not give you enough to decide how you can best decrease that pain. So we might use secondary to. Okay, so I might say acute pain related to inflammation secondary to cellulitis. And that can be a nursing diagnosis or an injury or an illness or a surgery, because it's just telling us what it is that's caused that inflammation. Okay. Another thing that we might do is there might be some specifying language. We might have acute pain and then in parentheses headache related to caffeine withdrawal. Okay. So we're specifying the type of pain that they're having. So we might use specifying language. Some common mistakes are making assumptions rather than using assessment data. I once had a student had a patient that was post-op, and their entire assessment, the patient said like 35 times, I'm not having any pain, pain level 0. So the student wrote the care plan, and their highest priority diagnosis was pain, because the patient had surgery and that's what they thought, that's what the book says. But that patient didn't have pain, and it's very hard to write a care plan for a problem that doesn't exist. Okay. So don't make assumptions. Make sure you're using your assessment data. You don't need to include multiple problems in one diagnosis. The patient can have multiple nursing diagnoses because they may have multiple nursing sensitive problems we're addressing. The diagnosis needs to be supported by the assessment. Probably the most common is students choose an etiology that is not sensitive to nursing care, that related to the why they have that problem needs to be something sensitive to nursing care. So I cannot say that my patient has impaired gas exchange related to pneumonia, because my care plan is focused on fixing the cause of their impaired gas exchange, and I can't fix pneumonia. Okay. Impaired gas exchange related to inadequate thoracic expansion, bronchoconstriction, and excessive mucus. I can do things about all those. I can get that patient to drink water, have them cough and deep breathe, reposition them, have them use incentive spirometer. That's going to affect all of those things, right? And improve their gas exchange. Okay. This is going to be probably the most challenging piece. If you are struggling with nursing diagnosis, please let me know. When we do our case study care plan day, you're going to do a simulation assessment of a patient in lab, and we're going to work as a whole group developing nursing diagnosis and care plan for that patient.